don't you tell us a little bit about where you practice, what your specialty is, and what type of patients that you treat?
Well, I'm a trained obstetrician and gynecologist, but I no longer practice obstetrics, focusing on gynecology. In particular, I treat a lot of chronic pain patients, in particular pelvic nerve injury patients. And I practice in southern New Hampshire out of St. Joseph Hospital in Nashua, New Hampshire.
And what made you become interested in treating pelvic pain, particularly pelvic nerve injuries?
I've always been interested in pelvic pain since my training, but focused generally on the more classic gynecologic causes for chronic pain, such as endometriosis, that type of thing. But I got into the pelvic nerve injury patients as a result of a patient of mine who developed pudendal neuralgia after I performed a prolapse procedure on her. Must be almost 16 years ago, and that what started my journey into this world.
Okay. So today I want to talk about women who have a history of pudendal neuralgia, or maybe are still suffering from the symptoms of pudendal neuralgia, but would like to get pregnant. So are there any restrictions on women becoming pregnant who have had pudendal neuralgia in the past, or maybe currently suffering from symptoms of pudendal neuralgia?
Per se, there's no restriction on pregnancy. It's not pregnancy is not contraindicated, a term we use in medicine for this condition. Logistically, for some patients, if they're having severe trouble with painful intercourse, some women actually get to the point where they're unable to have intercourse. They may have to do artificial means for conception, such as intrauterine insemination or something like that.
So having a history of pudendal neuralgia does not affect a woman's fertility, but it may affect her ability to become pregnant due to pain with intercourse?
Correct.
And once a woman does get pregnant who has a history of PN or currently suffering, do women often have more symptoms when they're pregnant or less symptoms, or what is your experience?
Well, we don't have a huge amount of scientific data on this, as nothing's really been created or published regarding pregnancy and pudendal neuralgia. From our clinical experience only, so this is really kind of anecdotal, many women will see increased symptoms during pregnancy. So let's say someone had a history of pudendal neuralgia in the past, they responded really well to treatment, doing pretty good. When they get pregnant, they will often see an exacerbation of symptoms, especially as they get into the third trimester, when really the weight of the pregnancy and the force on the pelvic floor and the lower back start to exacerbate symptoms.
I see. So it's the weight of the baby, maybe postural changes, and how does that exactly affect the nerve?
Well, again, it could put stretch on the nerve,
Okay.
A tension type situation, or the increased pelvic floor tone that's required to support the pregnancy also could put a traction on the nerve.
I see. So as the pelvic floor muscles have to work harder in order to support baby and growing mom, that can put pressure on the pudendal nerve.
Yes.
I see. So what types of treatment may you suggest for a woman who's pregnant and is having an exacerbation of her PN symptoms?
Well, like for all of our pudendal patients, one of the first things we talk about is pudendal protection.
Okay.
So activities or postures that seem to exacerbate symptoms, to try to limit those as much as possible.
Okay.
And
what would some of those behaviors or activities or postures be?
Like excessive sitting,
Okay.
squatting, those types of maneuvers which put strain on the pelvic floor or compress the nerve directly from sitting.
Great. Any other treatment interventions that you would recommend besides pudendal protection?
Often physical therapy,
Okay.
assuming the patient has access to an adequately trained physical therapist who actually knows how to treat pudendal neuralgia, especially someone who is experienced with treating pregnant women as well. That combination is going to be ideal for these patients.
Right. Are these patients able to take medications that someone with pudendal neuralgia may typically take, like an anticonvulsant or an antidepressant?
Many of those are contraindicated in pregnancy, so they'd
Okay.
have to discuss that with their obstetrician.
I see. How about things like pudendal nerve blocks and those types of interventions? Are those appropriate for a pregnant woman?
They could potentially be appropriate. Pregnancy is not a contraindication, although most are done under fluoroscopy. So it'd have to be done later in pregnancy, before 20 weeks. That's relatively contraindicated.
I see.
After 20 weeks, the dose of radiation is relatively small, and the fetus shouldn't really be affected by it.
I see.
But it couldn't be done repeatedly.
Right. Right.
Of course, if it was done under ultrasound guidance or just digital guidance, that would be fine.
And digital guidance means,
Just by palpation.
okay, so that would be done through the vagina just with palpation. I
Correct.
see. Okay. And how about as the woman prepares for labor and delivery, what sort of advice or recommendations would you give a woman with a history of PN or maybe currently suffering from PN?
Well, again, we don't have any randomized trials or anything like that to look at this. But since childbirth is one of the conditions that often triggers pudendal neuralgia, so we know the pudendal nerve is subject to injury during the delivery. Vaginal delivery is relatively contraindicated, and I generally recommend to my patients that they have a cesarean birth.
And for patients that maybe their obstetrician is not very familiar with pudendal neuralgia, how would you suggest they broach that subject of an elective cesarean section to their obstetrician?
Well, so again, the idea of an elective cesarean section is not nearly as controversial now as it was 20 or 30 years ago. Many women just elect to forego labor and have elective cesarean sections. The procedure is extremely safe. So I think it's unlikely that most obstetricians would put a huge amount of pushback on this, but I think she would just say, I have this condition, pudendal neuralgia. I've been advised by my treating physicians that I should have a cesarean birth, and I think most obstetricians are very open to that. For my patients who have gone through that, I think I've only had one or two of their doctors call me to actually confirm that this was my recommendation.
I see.
Everyone else just took the patient's word for it.
I see. So to go back to why you would recommend a cesarean section for these women, what is it that happens during labor and delivery that can compromise the pudendal nerve?
There are two main mechanisms. During the delivery of the fetal head, there is direct compression on the pelvic sidewall in the vagina that could potentially compress the nerve and crush it in that way, especially if the patient has a prolonged, what we call second stage of labor, when they're fully dilated and pushing. The other is a traction injury, that the nerve gets stretched significantly as the baby's head delivers through the vagina. There have been studies where they have measured pudendal nerve function in women immediately after birth, and they find virtually all of them have conduction abnormalities of the pudendal nerve. Thank goodness, when they retested them at 6 weeks, the vast majority of them had returned to normal.
So can you just explain what you mean by conduction abnormality?
There is this measurement called the terminal latency of the pudendal nerve. It measures the length of time it takes the nerve to conduct a signal from one point to another point, and that is delayed because of the nerve injury that took place during childbirth.
And you said most of those nerve injuries do recover given enough time.
Yes.
And do those those nerve injuries, do they often result in symptoms such as pain or motor loss that could lead to things like incontinence?
Temporarily, many women do experience some motor loss, in particular, with issues with continence that often rebounds spontaneously.
Okay. Right. And so, should a woman develop or choose to have a vaginal delivery that has pudendal neuralgia or a history of pudendal neuralgia, and the symptoms are exacerbated from vaginal delivery, what types of treatment and when would you suggest commencing such treatment for those symptoms?
Well, part of that depends on how much of an injury she has incurred, and whether or not there was extensive lacerations, etc. So you need all of that stuff, just the physical damage to heal before you could consider, let's say, physical therapy as an intervention. So I say there's probably at least 6 to 8 weeks for most patients.
Okay. And when, and for a woman who is breastfeeding, when is it safe for her to consider pharmaceutical interventions, such as medications that are typically prescribed for neuropathic pain?
So again, that's on a case-by-case basis,
Mm.
depending on the medication. Some medications are safe with lactating mothers, others are not.
Uh-huh.
And so that would have to be, again, a coordinated effort between the obstetrician or pediatrician and the treating physician.
Right. Any other words of advice or encouragement for women that have had PN or are still struggling with PN that want to start a family?
Well, just the fact that they should be relieved that it's not a contraindication to getting pregnant. That they should be able to get pregnant. Their fertility should be fine, and that with appropriate treatment and precautions, we can try to minimize their risk to have a bad exacerbation.
Great. Thank you.